Hi there, and thank you for watching. Today, our group is going to be discussing the barriers and enablers of interdisciplinary collaboration in Canadian healthcare teams. More specifically, we are going to be defining collaboration and give a little bit of a background on interdisciplinary collaboration, as well as go over the barriers and enablers of professional attitudes and communications, as well as stereotypes and role clarity. Collaboration, defined as the relationships and interactions that occur between coworkers, is a complex, dynamic process that is not yet fully understood, much less operationalized. The earliest documented interprofessional collaboration in healthcare dates from the beginning of the last century, but it was only after World War II that there was a proliferation of work on multidisciplinary teams. Over the past 25 years, attention has been placed increasingly on how interprofessional teams can improve professional relationships, collaboration, and quality of care. As a result, improved teamwork is a near universal aspiration of health and social care practitioners, managers, and organizations. Interdisciplinary collaboration among healthcare professionals is necessary to provide exceptional care for patients. Improving professional attitudes, effective communication, eliminating stereotypes, and clarifying roles would help conquer barriers among health professionals and enable a more cohesive and dynamic team to create an optimal plan of care for patients in all healthcare settings. When health professionals fail to work collaboratively, then they fail to plan for the care of their patients. It is essential to have communication and to carry professional attitudes in an interdisciplinary collaboration. However, communication can also be seen as a barrier if it is not used properly. As such, communication barriers can arise and hinder the team's progress. Although they all have the same goal, each disciplinary can go about the task in different ways due to their values. These values are often internalized in the profession's training and career, which may cause obstacles among team members. Furthermore, in order to have a cohesive team, it is necessary for the members to cooperate, take responsibility, have effective communication, and be able to work independently as a team member. Without the proper exchange of ideas and information, they will not be able to discuss the patient's healthcare plan and can end up delaying the patient's treatment. Inadequate communication among healthcare professionals may ultimately result in severe consequences. Beyond the misunderstandings and frustrations experienced by the various healthcare professionals, patient care will be compromised, which may lead to detrimental effects for the patient. A very obvious solution to this problem is to change the communication barrier faced in interdisciplinary collaboration into enablers. Effective communication is essential in any field. However, its importance is so vital, particularly in the healthcare profession. An important component in effective communication among different healthcare professionals is valuing the roles and responsibilities of others. Past the role clarification phase, role valuing is so crucial to ensure that all members who are a part of the team understand the importance of the different professions. A way to establish this could be through the use of workshops and educational interdisciplinary meetings to further inform the healthcare staff of the roles of other health professions. This will in turn be met by positive changes in communication and attitudes among the members of the team. Role valuing will also greatly aid in positively changing the attitudes of the different healthcare professionals. If one has a clear and thorough understanding of the roles and responsibilities of the different members of the healthcare team, this will result in positive attitudes and ultimately will lead to high quality patient care. With positive changes in attitudes and communication among individuals, the opportunity to build trusting relationships arises. Along with building trusting relationships, professionals should seek the need for exploration of other professions. This realization will ultimately take place after the role clarification phase, when hopefully the attitudes of the different individuals of the team changes. When everyone is keen to educate themselves about the roles and responsibilities of one another, a drastic positive change in the attitudes of the individuals and the tone of the entire team will be quite evident. Teams work most effectively when they have a clear purpose, when goals are defined, and when each individual in the team is aware of how their skills can be used most effectively to complete the distinct task. Role clarity, along with assumed stereotypes of other healthcare professions, can become a barrier to interdisciplinary collaboration if not effectively executed and discussed prior to work implementation. Not only is it vital for each worker to be aware of their own responsibilities, but for role clarity to be fully implemented, each specialist needs to understand and recognize the values and roles and responsibilities of each professional working on the team. When respect for skill and competency of each team member is recognized, only then can a team work effectively towards the optimum care of the patient. One of the largest barriers to role clarity and respect for varying skill sets is profession stereotyping. Effective interprofessional learning is highly dependent on the attitudes of healthcare professionals towards their own and other healthcare workers. Therefore, misunderstandings of role clarity and attitudes of healthcare workers in different streams result in ineffective healthcare implementation. Stereotyping and role clarity often causes issues amongst healthcare professionals. A primary solution is having a solid framework behind their actions. When there is an organizational structure in place, the individual's thoughts are guided and in turn affect their behavior as well as their professional practice. Having structure leaves little room for assumptions and misunderstandings. Health professionals have their roles and scope of practice, and work must be allocated appropriately in order to work successfully together and avoid unnecessary overlapping. If decisions and plans are made as a team, everyone understands their roles as well as what others' roles are. All employees should treat one another with respect and dignity, which should be reinforced and punishable if not followed. Finding solutions to these problems and working together in a healthcare team are extremely important as they affect overall patient care. In conclusion, the challenge for members of interprofessional teams is to manage the team processes that occur in all teamwork while simultaneously manage their individual professional identities. The task of individual team members is thus to reform healthcare where conventionally organized care has failed, as well as managing among themselves the team processes that occur in all teamwork. Team members are expected to manage the competing agendas upon which their various professional identities are based. Patients, clients, and service users frequently have conditions that have multiple causes and require multiple treatment from a range of health and social care professionals with different skills and expertise. As it is unusual for one profession to deliver a complete episode of care in isolation, good quality care depends upon professions working together in interprofessional teams. Every member not only knows the responsibilities and activities of every other role on the team, as well as having an understanding of the personal nuances that each individual brings to their role. Improving professional attitudes, effective communication, eliminating stereotypes, and role clarity would help conquer barriers among health professionals and enable a more cohesive and dynamic team. Without these fundamentals, the end outcome would be disastrous, not just for teamwork itself, but for the clients involved. Understanding and accepting the other health professional roles and belief systems would enhance the plan of care, and the client would receive optimal level of care. This must be a priority because the client's life may depend greatly on the function of the healthcare team. Fragmentation must be avoided to reduce healthcare provider burnout and medical errors. Embracing and accepting the other professionals' roles is a start for successful team building and trust among all healthcare professionals. Thank you very much for listening. Our references are listed